7 common medications that can be harmful to your kidneys. We live in an era where medications are ubiquitous. While they can provide significant benefits, they can also have serious, often silent, adverse effects. Understanding the potential risks and side effects of medications is crucial, especially as we age and our bodies become more susceptible to damage. Our kidneys are vital organs that play a crucial role in maintaining overall health. They filter waste products from the blood, regulate electrolyte levels, and manage fluid balance. As we age, our kidneys' efficiency declines, making it essential to protect them from excessive exposure to chemicals and medications. Kidneys are responsible for filtering about 200 quarts of blood daily, producing approximately 1 to 2 quarts of urine. This process removes waste and extra fluid from the body, helping maintain a stable balance of salts and other substances in the blood. Additionally, kidneys produce hormones that help regulate blood pressure, produce red blood cells, and maintain healthy bones. As we age, our bodies undergo various changes, and managing health often involves taking multiple medications. However, certain medications can be nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. This damage reduces the kidney's ability to filter blood, leading to a buildup of harmful waste and serious health complications. Kidney damage can be measured in stages, ranging from mild dysfunction to complete failure. The risk of drug-induced nephrotoxicity increases with age and existing kidney conditions. There are 2 primary types of kidney damage from medications: dose-dependent toxicity, where damage increases with higher doses, and idiosyncratic toxicity, which is unpredictable and varies greatly among individuals. Dose-dependent toxicity. This type of toxicity means that the extent of kidney damage increases with the dosage of the medication. Higher doses or prolonged use of certain drugs can lead to more significant kidney damage. Idiosyncratic toxicity. This type of toxicity is unpredictable and varies between individuals. It is not necessarily related to the dose and can occur unexpectedly, causing severe kidney damage in some people while having no effect on others. Drug-induced nephrotoxicity can result from various mechanisms, including muscle tissue breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup, renal tubular acidosis. These conditions can result in decreased kidney function and other related issues, such as nephrotic syndrome or electrolyte imbalances. In this comprehensive guide, we will explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Understanding the risks associated with these medications empowers you to make informed healthcare decisions. Before we dive into the specific medications, kindly note that all information you'll find in this guide is produced by humans and for humans. Visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to generate content automatically. Our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 1. Antibiotics. Antibiotics are frequently prescribed but come with risks. Your doctor might prescribe antibiotics for a sore throat, skin infection, or other infections, potentially harming your kidneys. Antibiotics, also known as antibacterials or antimicrobials, combat bacterial infections by killing bacteria or preventing their reproduction. Common antibiotics include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. These drugs treat strep throat, pneumonia, urinary tract infections, UTIs, or skin infections, but not viral infections like colds, flu, bronchitis, most coughs, and most sore throats. Antibiotics are crucial in treating bacterial infections. They work by targeting specific bacteria, either killing them or inhibiting their growth. This helps the immune system overcome the infection more efficiently. However, antibiotics do not discriminate between harmful and beneficial bacteria, often disrupting the natural balance of microorganisms in the body. Improper prescription can lead to side effects like diarrhea, liver, and kidney problems. Even when used correctly, antibiotics like polymyxins, aminoglycosides, and vancomycin can harm your kidneys. Kidneys play a crucial role in removing antibiotics and other drugs from your body, but some antibiotics can damage kidney cell membranes or accumulate in kidney cells, causing cell death and harming kidney tubules. Now let's see 3 types of antibiotics. Polymyxins. These antibiotics can damage kidney cell membranes, leading to kidney injury. Polymyxins are often used as a last resort for treating multi-drug-resistant infections. Aminoglycosides. These antibiotics can accumulate in kidney cells, causing cell death and damaging kidney tubules. Aminoglycosides are commonly used to treat severe infections caused by gram-negative bacteria. Vancomycin. This antibiotic is used to treat serious infections caused by gram-positive bacteria, including MRSA. Vancomycin can cause kidney damage through various mechanisms, including oxidative stress and inflammation. Did you know that nearly 1/3 of antibiotics prescribed in the United States are inappropriate for the conditions being treated? This alarming statistic highlights the importance of cautious and informed use of antibiotics. According to a report from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association, many antibiotics are prescribed unnecessarily or for conditions that do not respond to these drugs. Before you ask for an antibiotic, or if your doctor prescribes one, it is important to know which conditions they can treat. You can ask your doctor questions like, "Is this necessary?" And most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. 2. Nonsteroidal anti-inflammatory drugs. Many people don't recognize NSAIDs by name, but are familiar with ibuprofen, aspirin, Motrin, ketorolac, celecoxib, and naproxen. These drugs, available without a prescription, are commonly used to ease headaches, sprains, strains, colds, flu, and arthritis pain. NSAIDs mainly work by blocking cyclooxygenase, COX, an enzyme that produces pain-causing substances, but also protects the kidneys during stress and helps regulate sodium and water excretion. NSAIDs block COX enzymes, reducing the production of prostaglandins, which are substances that promote inflammation, pain, and fever. However, prostaglandins also play a crucial role in protecting the stomach lining and maintaining blood flow to the kidneys. By inhibiting COX enzymes, NSAIDs can reduce inflammation and pain, but also cause gastrointestinal and kidney problems. Blocking COX can cause acute kidney injury, AKI, especially in older people and when taken in high doses or over extended periods. This injury appears as changes in blood flow and inflammation caused by blocking COX. Reduced blood flow can lead to fluid retention, high blood pressure, and mild temporary kidney impairment, potentially progressing to chronic kidney disease. Prolonged use can trigger inflammation in kidney tubules, leading to kidney issues affecting 1% and 5% of daily users worldwide. NSAIDs are often involved in hospital admissions due to adverse drug events, some fatal. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 184 people who were prescribed NSAIDs for various conditions. The results showed that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. Another study found that most patients' kidney function decreased after NSAID use, but returned to normal after switching to another pain reliever drug. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu, and arthritis pain. However, prolonged use can trigger inflammation in kidney tubules, the tiny structures that filter waste. This inflammation is rare, but overall, kidney issues stemming from NSAIDs are a significant concern, affecting 1% to 5% of daily users worldwide. 3. Diuretics. Diuretics treat fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They work by increasing urine output and expelling excess salt and water, helping with hypertension, a leading risk factor for kidney disease. Diuretics work by altering the kidney's ability to reabsorb sodium and water, increasing urine output. This helps reduce fluid buildup in the body, lowering blood pressure and relieving swelling. However, excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. While diuretics are generally suitable for kidneys, they carry risks, particularly concerning kidney health. Excessive use or high doses can lead to dehydration, a risk factor for kidney damage. A study found that patients using diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. Higher doses increase the risk, with 27.5% of acute kidney injury cases caused by diuretics alone. A study looked at 131 patients using diuretics and having acute kidney injury from 1999 to 2010 at a hospital. At first, 96.2% of the patients already had at least one health issue before starting diuretics, with chronic kidney disease, CKD, being the most common at 55.0%. They found that patients who used diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the bigger the risk. About 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. Always consult your doctors before starting new medications with diuretics. For people with CKD who are taking diuretics, it is important to stay hydrated and regularly check for electrolytes and kidney function. Nowadays, there are more home testing options available than ever before, so people can now check their kidney function from the comfort of their own homes. 4. Proton pump inhibitors. PPIs treat GERD or acid reflux by reducing stomach acid production. While generally safe, PPIs carry risks for kidney health, linked with acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation between kidney tubules. Long-term PPI use may lead to lower kidney function and acute kidney injury, potentially progressing to CKD. PPIs can also cause low magnesium levels in the blood, hypomagnesemia, linked to CKD. PPIs work by targeting an enzyme in the stomach called H+K+ ATPase, or proton pump, which is crucial for acid secretion. By inhibiting this enzyme, PPIs reduce the production of stomach acid, relieving symptoms of acid reflux and GERD. However, long-term use can disrupt the body's natural processes and lead to kidney problems. For example, PPIs have been linked with acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Even though only a tiny number of PPI users develop AIN, This drug has become a common cause of drug-induced AIN in developed countries. More concerning, AIN caused by PPIs often shows no apparent signs and often goes unnoticed. Long-term PPI use may lead to lower kidney function and acute sudden kidney injury, potentially progressing to CKD. A 2019 cohort study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. This study checked how PPI use relates to new cases of acute kidney injury, AKI, and chronic kidney disease, CKD, in a large group of people. When they examined a group of 93,335 people, they found that those taking PPIs had a 4.35 times higher risk of AKI compared to those who didn't. Similarly, taking PPIs was linked to a higher risk of CKD. When researchers examined a group of 84,600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. People taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. It is essential not to let the solution to one problem become the source of another. While PPIs can provide significant relief from acid-related issues, long-term use of them can harm your kidneys and cause other problems, such as infections, fractures, or nutritional deficiencies. Take PPIs for the shortest time possible to relieve acid-related issues without raising the risk of side effects. 5. ACE inhibitors. ACE inhibitors lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors include lisinopril, ramipril, enalapril, and benazepril. They block an enzyme that produces angiotensin II, narrowing blood vessels and increasing blood pressure. By stopping this enzyme, ACE inhibitors help relax blood vessels, lowering blood pressure and reducing stress on the heart. ACE inhibitors block the angiotensin-converting enzyme, reducing the production of angiotensin II, a hormone that narrows blood vessels. This leads to the relaxation of blood vessels, lowering blood pressure and reducing the workload on the heart. ACE inhibitors also improve blood flow to the kidneys, easing their workload and reducing protein in the urine. While ACE inhibitors offer protective benefits, they are not without risks. Mixing them with NSAIDs and diuretics can increase the risk of acute kidney injury, AKI. Additionally, not drinking enough water while taking ACE inhibitors can elevate the risk of AKI. Some people are concerned that ACE inhibitors might decrease the estimated glomerular filtration rate, eGFR, a measure of kidney function. However, ACE inhibitors reduce eGFR by relieving pressure on the kidneys, allowing the small filters, called glomeruli, to relax. In rare cases, particularly in patients with conditions like heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, once the medication is stopped, most patients recover without lasting kidney damage, even after needing dialysis. Patients with heart failure, diabetes, or CKD benefit from ACE inhibitors because they ease the strain on the kidneys and offer long-term kidney protection. However, dosages should be adjusted carefully, and kidney function should be regularly checked. 6. Antiviral drugs. Antiviral drugs treat serious or long-lasting infections like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. They clear the flu and combat other viruses, but can harm the kidneys. Antiviral drugs like remdesivir can cause kidney toxicity in people with kidney issues. Clinical trials have inconsistently reported decreased kidney function with remdesivir, and data showed a significant increase in acute kidney failure cases compared to other COVID-19 drugs. Antiviral drugs work by inhibiting the replication of viruses, reducing their ability to cause disease. Some antiviral drugs, like remdesivir, contain substances that are mainly removed from the body by the kidneys. In people with kidney issues, these substances might build up and cause kidney toxicity. Some antiviral drugs, such as cidofovir, adefovir, foscarnet, acyclovir, interferon, and tenofovir, can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins. This condition is called acute tubular necrosis. Additionally, the antiviral drug atazanavir can cause inflammation in the interstitial tissue of the kidneys, impairing kidney function. Acyclovir, indinavir, and foscarnet can cause crystals buildup in the kidneys, blocking the kidney tubules. For example, remdesivir, a drug for emergency use in COVID-19 cases, contains a substance called SBECD, which is mainly removed from the body by the kidneys. In people with kidney issues, SBECD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported a decrease in kidney function with remdesivir. Moreover, data from global databases showed a significant increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 drugs. Taking these drugs under close medical supervision is crucial to safeguard the kidneys. Never skip doses or take antivirals inconsistently, as this can lead to virus adaptation and reduced effectiveness, known as antiviral resistance. Also, note that antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 7. Lithium. Lithium is a mood stabilizer for mental illnesses like mania and bipolar disorder. Common brands include Priadel, Camcolit, Lisconum, and Lie Liquid. Long-term lithium use can cause serious kidney issues, including acute and chronic kidney disease and kidney cysts. Early kidney damage from lithium might be reversible, but it can become permanent over time. Lithium works by stabilizing mood and reducing the severity of mood swings in conditions like bipolar disorder. However, it can affect the kidneys by disrupting their ability to respond to antidiuretic hormone, ADH, leading to nephrogenic diabetes insipidus. This condition causes excessive thirst and frequent urination. Lithium can cause nephrogenic diabetes insipidus, where the kidneys can't respond to antidiuretic hormone, leading to excessive thirst and frequent urination. In rare cases, long-term use can lead to end-stage renal disease, ESRD. Symptoms of kidney trouble from lithium include excessive urine output, frequent nighttime urination, and dehydration signs. Lithium can also cause low sodium levels, hyponatremia, leading to serious problems if untreated. Lithium has been used for over 60 years to enhance the lives of individuals suffering from bipolar disorder. While it can be a lifeline for calming mood, its impact on the kidneys cannot be ignored. Early on, kidney damage from lithium might be reversible, but it could become permanent with time. The main issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus. Patients should maintain a regular diet with enough salt and fluids while taking lithium. It is important to define a suitable dosage, get yearly blood tests to check creatinine levels, and seek medical help if needed. Lithium can harm you in many ways, not just by damaging kidneys. Before starting it, let your doctor know if you have kidney, heart, thyroid, or breathing problems, Addison's disease, or Brugada syndrome. Extra tips for cautious use. If you suspect your medication affects your kidney health, seek medical advice immediately. Symptoms of kidney failure might not be apparent initially, but worsen over time, leading to decreased urine output, leg swelling, shortness of breath, and severe fatigue. Check your kidney function regularly with blood creatinine levels, GFR, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins. Be aware of potential interactions between prescriptions. Share all current medications with any healthcare provider who prescribes a new drug. Medications are essential for treating various conditions, but certain drugs pose significant risks to kidney health, especially in individuals with existing kidney disease. Antibiotics, NSAIDs, diuretics, PPIs, ACE inhibitors, antiviral drugs, and lithium can impair kidney function. Work closely with healthcare providers to select treatments that minimize kidney risk, adjust dosages, and monitor kidney function. A healthy lifestyle can help minimize medication use. Eat a balanced diet, exercise regularly, and protect your kidneys from damage. Subscribe to us and hit the bell icon for more life-saving videos. Enjoyed this video? See you there. Stay informed, stay healthy.